Hi, everybody. Welcome to the Eco Mindset podcast. Today we have a very special episode for you. I'm joined by Sarah Lalonde, who is a doctor who served in Gaza during the current conflict. She worked at the European hospital in Khan Younis. At the time that we're recording this episode, there's over 60,000 people that have been killed in Palestine. Apparently, 80% of those are civilians. There's 50,000 children that are killed or injured. At least 17,000 of those children have been killed. That works out to about 30 per day since the beginning of this conflict. That means that there's a Palestinian killed every 45 minutes. Palestine and Gaza has the most amputated children per capita in the world. There's also been 224 humanitarian workers that have been killed, 180 journalists, and over 120 academics. So when I heard about Dr. Lalonde's trip to Gaza to see what she could do working really on the front lines of this conflict, especially in a place where hospitals have been repeatedly targeted by the Israeli military, I thought that would be a very important story to share with our listeners. So thank you very much, Dr. Lalonde, for being with us and for your very courageous trip to Gaza. Can you tell us a bit about your background? What led you to study emergency care, and what brought you to Gaza?
Yeah, so thank you for having me. It's an honor to be here, and it was an honor to go to Gaza as well. And I I applied to medical school after going to undergrad. I was motivated to study medicine because I love the practical aspect of biology in medicine, and also the concrete way to be able to help people on a day-to-day basis in a way that's very concrete and very hands-on, and it's also very much in a one-on-one kind of interaction type of way. So that was some of the motivation that I brought to the medical field. There weren't previously doctors in my family, so it was an idea that I thought of to that I didn't have a lot of familiarity with. And after attending medical school, I decided to pursue. I was interested in mental health, in family medicine, and in emergency medicine, and I was able to combine all that by becoming doubly certified in family medicine and emergency medicine. And then since I graduated, I finished my fellowship in emergency medicine in 2015. I've had a pretty broad career, so I worked in some rural emergency departments, some community emergency departments. I also worked up north with indigenous people, with the Innu Nation, Cree Nation, and the Inuit.
Hmm.
And I've also worked overseas. So I worked with in Albania with Afghan refugees after the fall of Afghanistan in 2021.
Wow. Well, it's really impressive that you've worked so many places, and especially in emergency care, because I imagine it's one of the more stressful ways to practice medicine when you have people coming in and that have just been injured, and it's your job to take care of them. So I think that's a really important thing, and I think that it takes a lot of courage, to be an emergency room doctor anywhere, but obviously in a conflict zone, the injuries are quite different. Can you take us through a typical day working at the European Gaza hospital?
Yeah, so typically we would arrive in the morning. We would hear about the cases that had been seen overnight, and we would start our day. As we started our day, often there were traumas that came in, so the nurses would yell. There was one board certified emergency doctor who worked at the hospital. The trauma activation mechanism was basically the nurses yelled his name, and then some people brought the patients into our trauma bay where we saw them. And I was working a lot in that area they called the red zone, where we saw the sickest patients. And then throughout the day, we would see a variety of patients. So we saw different categories of patients. We saw some patients who had been impacted by violence directly related to the current genocide. So we saw people shot by snipers, quadcopters, bombings, and also unexploded devices that children found. We saw people who were affected by violence that is related to the genocide but wasn't armed. Like, for example, we saw people who had, kids who had fallen from many stories because they were living in an unsafe structure. Or we saw a child who an object fell on him that weighed 500 pounds, and then the child passed away. We saw also, kids who had lots of foreign bodies in the feet caused by walking around in the rubble without any shoes. We saw lots of people as well who had problems related to hygiene, so gastrointestinal diseases or rashes or things like that. We saw people who had uh, non-communicable diseases like high blood pressure or heart failure, but that had not received any medication for a year and a half and were very decompensated or had the complication of that disease. For example, if your high blood pressure goes completely untreated and then you end up bleeding inside your brain. So we saw these type of patients.
Right.
We also saw people suffering from mental health conditions related to the genocide and their experiences. And we also received the prisoners. So I was there during uh, the so-called ceasefire, and during that time we received the prisoners who had been in Israeli prisons for some time, and we were the ones receiving those prisoners.
Wow. And what kind of shape were the prisoners in when they were released from the Israeli prisons?
Well, the prisoners all suffered from neglect, malnutrition. They were all malnourished, and they all had scabies, or most of them
Mm.
had scabies. So they had had untreated skin conditions that went on for years. For sometimes our patients would tell us they had scabies for a year. And the we also saw a lot of other medical conditions in the people that we saw released from prison. For example, we saw people who had had untreated medical conditions. They asked for medication, they didn't get it. And sometimes those patients explained to us that they were beaten when they said they were sick in the prison by physicians.
Right.
They also described some kind of psychological torture, or one of them told us that he received mystery injections and he was told that the things he was injected with would make him sick for life. Some of them described sexual torture. Some of them described recent beatings and threats to their family upon leaving the jail. So the prisoners were really in terrible shape from a psychological, physical, mental, and emotional perspective.
Yeah. Just coming back a bit, what is it that inspired you to go to Gaza to be in the middle of this conflict zone and being helping out that way? Did you have a personal connection to the region? Is there some people that you know that were over there? Is there a story that inspired you to go there?
Yeah, so I don't have a connection to the region. I'm not Jewish or Muslim. I'm not Israeli or Palestinian. I I did have an experience. I went to Israel in 2015. I was curious about the country after many of my friends had spoken about it. And I visited Israel, and then I decided I would go to the West Bank. And I ended up going on a tour to a town called Hebron. And at that town, in that village, it's quite a tense location. There's a lot of settlers there and a lot of IDF soldiers to protect the settlers, as well as 200,000 Palestinians, I think, were living there at that time. And it's a very tense location. For example, when we walked through the market in Hebron on the Palestinian side, there's a gate installed above the market to prevent people from the other side throwing stones or other things into the market. And there's an Israeli soldier who has his gun pointed at you as you walk through the market. So it's a very tense location. And we visited that area, and then we went through a checkpoint, and we went to go visit the mosque. The mosque is called the Ibrahimi Mosque, and it's named that way after Abraham, who is said to have buried his wife Sarah underneath the mosque. And as we were leaving the mosque, I realized that one of the border police looked very angry. So one of the other people on the tour decided to hide, and I decided to hide with him behind a wall. And while I was hiding behind the wall, there was a young girl by the name of Dania Ershad who was coming home from school. She had gone through the checkpoint, which involves multiple metal detectors, which are very good at detecting metal, and the Israeli border police killed her, and she died on the ground in front of my tour guide. And after that experience, we went into the house of someone nearby who was supposed to be serving us lunch. And that woman was feeling very distraught because there'd just been someone killed outside her house. And she was trying to manage her children who were running around the house like children do, while also trying to feed us lunch. And my tour guide was sitting there wringing his hands, because he had just witnessed this girl be killed in front of him. And that experience helped me to understand, as someone who has never experienced occupation, who has never lived in that type of situation, what that might feel like for someone.
Yeah. And what possible excuse could the Israeli military have to kill a 17-year-old civilian girl like that?
Well, if you look up the Israeli media related to that particular shooting, which was on October 25th, 2015, they said that she had a knife. And they said, one of their articles said that they neutralized a terrorist at the checkpoint. So that was the what they released after that event. And other groups have spoken about that specific incident, including Amnesty International, Electronic Intifada, and there's been many people who've spoken up about that. And that was not a singular event. That fall, there were many, many children killed at the checkpoint.
Yeah. And these killings this way, in your view, they're made to terrorize the population. You have all these people witness this. You have the family involved. You have the morale of the Palestinians in general. What is Israel trying to do by doing this?
Well, I can't say what Israel is trying to do, but I can say what I observed as the end effect of that, which is that in the West Bank, it's very clear that there are two systems for two different types of people. One system, if you are Israeli or a settler, so you're coming from somewhere else, and you have some kind of identity that fits well with the nation of Israel. And another set of laws and systems for Palestinian people, right? So, for example, these killings have been referred to as extrajudicial killings, right? Because you're killing somebody without any kind of process. And I don't think that that's something that would be accepted for Israeli citizens. And it's been well documented by many human rights groups, including Israeli human rights groups. For example, B'Tselem, which is an Israeli human rights group, that actually the name of B'Tselem means in the image of God, right? Because in the Judeo-Christian tradition, it's stated that humans are created in the image of God. And B'Tselem was complaining in the year 2003, they put out an article complaining about attacks on healthcare and specifically ambulances not being able to get to people who are sick, Palestinians who are sick and need to go to the hospital. And that's what happened in this particular shooting, is that there was some delay or prevention of ambulances to get to the girl who was dying after she was shot.
Right. So first they shot her, then they stopped the ambulance from coming.
Mm-hmm.
Yeah.
Yeah. Yeah.
It's a very sad situation. So when you're visiting these regions, I hear that there's, segregation. There's often different streets depending on whether you're Israeli or not.
Yeah, so there's a whole system. When we talk about the West Bank, there's a whole system of roads, and depending on your particular racial or cultural background, you're allowed to use one road or the other. And that's why many human rights groups, including Israeli human rights groups, have called that system apartheid, right? Because apartheid is a system where we have different rights based on our skin color or racial or religious identities.
Right. And how do they determine who gets to walk on which road?
Well, there's a complicated administrative system in place, right, to ensure that people abide by these rules that are enforced by the Israeli government.
Okay. Okay, and it's Israeli citizenship that you need, or like somebody from Canada can go and walk on either side of the road that way, or?
That's right. So as a Canadian citizen, I had a lot of privilege in that context. I was able to travel on whichever roads that I would like to use.
Right, right. And how do you find that this compares to like segregation, let's say in the southern United States during slavery? Is it somewhat similar?
Well, I think we have to call into question any system where people have different rights depending on their race, right? Like we would not accept that in Montreal, right? Imagine if
Imagine,
people
yeah.
came to the emergency room in Montreal and I said, "Oh, you're Chinese, so you're not going to get a head scan even though the guidelines dictate it. Oh, but you're of a different race, so you will get your head scan." Like we would never accept that for people here, and I hope that we wouldn't accept it for anybody in another country as well.
Yeah, that's it. I mean, in Montreal, if anything, we try and find a doctor who speaks Mandarin to serve those people, right?
We would hope to do that, yeah.
Yeah, yeah. Okay, so I guess that killing of that young girl was maybe a turning point that led you to want to come back and to try and help, you know, heal some of the people from these horrors that are being inflicted on them.
Yeah, it got me thinking about Canada's role in Palestine, and also some of the things that I'd been taught about Palestine and Israel, and I ended up doing some learning about that, and that led me wanting to go to Gaza. I wanted to go to Gaza since 2016,
Yeah,
and then I was able to go in February of this year.
yeah. And is it a group that you went there with? How did you come into contact with the hospital and set up your time over there?
So I went with a medical solidarity organization called GLIA, and that organization was founded by Dr. Tarek Loubani, who is a Canadian and Palestinian, sorry, emergency physician who's been to Gaza many times. And I've been following his work and the work of his organization since about 2016, 2018, around that time. Yeah.
Yeah. And so you mentioned that the ambulance are being kept away from the patients, having dramatic consequences. But of course, the Gaza Strip is also under a blockade from Israel. They've blocked all kinds of humanitarian aid going in, medical supplies, food, water, everything. We've had Israeli cabinet ministers, even referring to Palestinians as animals as they continue to starve them and to not allow these critical supplies in. And we've had all kinds of rhetoric from the West about building a special port in Gaza and all this, and as if there's just some logistical thing that makes it so that the aid cannot get to where it's going, when meanwhile it's being blocked at the border by the Israeli government that could easily flick a switch and let the trucks flow in. I hear that these shortages have impacted hospitals quite a bit. Um, how were you able to get by with reduced medical supplies?
Yeah, so when you talk about supply issues, just before we go to that medical question, I want to make a comment about something you said, right? So many of my Palestinian friends have been going to the GHF, right, the Gaza Humanitarian Foundation, which was set up by the Israelis and the Americans. And I've been receiving texts from my friends, some of who've lost limbs. My friends have had their friends killed at these aid sites. And also recently on last Saturday, I had a friend of mine who was killed while he went to go get food. So in terms of the aid, the current aid situation that's been set up, it's really, really problematic. One of my friends said to me that her husband went to the new humanitarian institution, which is a death trap, not a place to help feed the poor. So there's huge supply issues and huge justice issues when it comes to the way that the aid is being distributed. I don't think we would have ever accepted, for example, during the Rwandan genocide, right, that the Hutus who were carrying out the massacres against the Tutsi and moderate Hutu people would be the ones distributing the aid, right? So that's a huge issue that you're mentioning about the aid getting in, right? And right now there's a huge issue also around baby formula. So my pediatrician colleagues have been complaining that the baby formula has been running out and has run out at the hospitals. And so that's a huge issue. In terms of how did we cope at our hospital? Well, there's a lot of makeshift solutions that have become kind of permanent. We're reusing all kinds of equipment that is not supposed to be reused. We're using suture kits that are not for human use. We're missing lots of medications. I was there during a time when there was more availability of things. And even so, we had no oral medication for pain for adults or children. And we also, there's a lot of supply issues also in terms of the equipment. For example, the CT scan had been damaged, and it's difficult to repair because of the blockade. And we used to have an MRI at our hospital. It was broken. Our ultrasound machines were in disrepair. So we had a lot of supply issues that impacted our patient. And they've only gotten worse since I left. So my colleagues were describing to me, even a couple of weeks after I left, that they were missing antibiotics and missing medication. And even while I was there, that was the case. Also, there's another attack on healthcare that we don't think about as often, which is the fact that they've killed many, many supervisors, right? So now a lot of young doctors who are doing excellent work, but they don't have as much supervision as they would have had in earlier times before those healthcare workers were killed by Israel.
Yeah. And you mentioned that there was no pain medication available. You're working in the emergency room treating people who've been shot and had all of these different, war-related injuries. How does that work?
Yeah, so we had some intravenous pain medication that we were giving, or we would give like use medication that at lower doses could provide some pain treatment. So we had our some solutions to that at the time that I was there. It wasn't ideal, and sometimes we were using medication that was less recommended for what we were doing, but that was the choice that we had. We were quite limited.
Did you have to operate on people without like anesthetic, without being able to put them like to sleep?
At the time that I went, there was anesthetic available at the hospital for the people in the operating room. And when I was suturing children or adults, for example, I did have some lidocaine or something to freeze the patient. There were small quantities, so we couldn't use like be as generous as we wanted to be, but there was some at the time I was there. Yeah.
Okay, okay. And you mentioned that there's been a lot of hospitals that have been attacked. Has the hospital that you worked at been attacked?
Yeah, so it's been attacked twice. So last year it was invaded by the Israeli Defense Forces, and it was taken over. And for a number of they, I believe they took over the hospital for about 1 month. That was last summer, I believe, last June. And then since I left the hospital was directly attacked in May. So the hospital was attacked with multiple missiles. The electricity was damaged. There was a giant crater outside the hospital, and people went into the crater and died. And there were people who were, my colleagues even said, were hanging on trees because they were blown from the ground as it was bombed. And then the next day, my colleagues valiantly tried to repair the hospital, and they had some kind of like construction machine, like a pickup or something, that they were using to try and repair. And the Israelis used a drone to target that construction tool, and the electricity of the hospital was completely ruined.
Right.
And now
This
they had to
sounds
transfer all the patients out of the hospital. I called my boss, actually. I was on the phone with him during that time right after the hospital was bombed. And the people who went to go outside and help at the hospital, who were trying to rescue the people from the crater, were also targeted. So there was a very deliberate attack of the hospital on that day and at many other times as well.
Yeah. So these sound like completely textbook war crimes. What do you think about the lack of accountability over these things and the fact that Canada is yet to accuse Israel of genocide, has yet to condemn these kind of war crimes in any kind of serious way?
Yeah, so I think as Canadians, we need to name the fact that this is a genocide. We need to stop the genocide and we need to sanction it, right? So some of my friends have been speaking recently in a coalition called United Against Genocide about naming it, stopping it, and sanctioning it, right? So Canada needs to speak out about this genocide. In terms of bombing hospitals being war crimes, I'm not an expert on war crimes. However, I don't think that we would find it acceptable if someone else did that. For example, uh, as you might know, the Prime Minister of Israel, Bibi Netanyahu, was quite sick in the fall and he was hospitalized. And had another person, another state, or another group of people bombed his hospital, I don't think that we would have found that acceptable as a global community, despite the fact that there are arrest warrants against him, both in his country and around the world.
Yeah.
So I think what we're accepting, what we're willing to accept for the Palestinian people as a global community, bears almost nothing in common with what we're willing to accept for any other group of people. And that's highly problematic. And as you know, Canada has been involved in genocides in the past and continues to be involved in the genocide of the Indigenous people in the form of the missing and murdered women, girls, and the other people who are missing and murdered. So Canada is involved in a genocide here and is also involved in the genocide. And it's not just to say that Canada should condemn their genocide, but the genocide that I witnessed in Gaza is also our genocide, right? So we're contributing directly to that genocide. For example, we're contributing with our tax dollars. We're contributing by contributing arms to Israel, and we're contributing in many other ways as well.
Yeah. Yeah, that's it. And I've definitely been to some parts of Canada, some Indigenous communities where you can see the evidence of the Canadian genocide. Canada may not be bombing hospitals, but perhaps they just don't build the hospital to begin with, and have people living in really substandard conditions without access to proper health care or education, and all this in an effort to try and get Indigenous people to leave their lands and leave their constitutional rights behind and sort of be assimilated into the mainstream Canadian population. So it's really incredible, the difference in level of services that people have access to. It can be quite incredible. You're a member of the group Doctors Against Genocide, and obviously you're very outspoken about what's taking place in Palestine. But here in Canada, there's been several different doctors and medical students that have faced disciplinary consequences for speaking out. And I'd be interested to get your perspective on, how it can be that in the middle of this humanitarian crisis, that people in Canada are being punished and reprimanded for speaking against what's taking place.
Yeah, exactly. So I've collaborated in the past with Doctors Against Genocide, and we've been to Parliament together. I'm not directly part of the group, but we're good collaborators. And also, there's a group here in Quebec called Médecins du Québec contre le génocide à Gaza that I've been involved in, and some other groups as well. So there's many of us who are speaking about this genocide, and many people have experienced huge issues at their work. Some people have been suspended. Uh, there's been cases of people, I believe, also who've received death threats and who have had career-altering events like being suspended or complaints or things like that. And that's not easy, right? And um, in terms of my experience with that, I've had, some challenging interactions both within my family and within the greater medical community. I had a mentor who had been my mentor for a number of years who told me that he never wanted to speak to me again after he saw the press conference I did on Parliament Hill, where I said that Canada should enforce the Genocide Convention. And that is challenging, but I think anything that me and my colleagues here in Canada will face is going to pale in comparison with what my Palestinian colleagues are having to deal with. So many of their family members have been killed.
Yeah.
Some of them have been called by Israeli officials and had their families threatened or their life threatened, or many have been tortured, many have been killed. They've had huge financial losses, and they're facing situations that we will never face. Like even before the Israelis invaded the hospital, my boss was trying to manage these impossible managerial questions of how do I provide good coverage for the patients at my hospital while not putting my staff at risk, because he knew that the Israeli snipers were about 800 meters from the hospital. So he was trying to see what's the bare minimum team that I can have so we can provide excellent care to the patients while not putting my staff people at risk, because they know that when they come to work, they could be kidnapped or killed at any moment. So these
Wow.
are managerial questions that no chief of staff in Canada will probably ever face, at least for the foreseeable future.
Yeah. And what do you say to your fellow doctors in Canada, maybe who have not taken a position yet, maybe out of fear of repercussions, or maybe they don't feel that their voice would have an impact? Like, what do you say to the many doctors in Canada who are still silent on this issue at this point?
Well, I have the perspective of working with a culture that has experienced genocide firsthand, right? I've met hundreds of residential school survivors. And you know, I think there's nothing that we wouldn't do as physicians, I hope, to turn back the clock and undo a genocide, right? There are so many effects of genocide on our patients that we cannot even understand or imagine them, right? When we think about things like diabetes or autoimmune diseases, these are all connected to epigenetics and cortisol exposure in childhood, and it's all connected to the genocide that these people have been through. And so as physicians, we need to not just treat the illnesses that we see, but we need to address the root causes, right? And if we would turn back the clock to help our genocide survivors here in Canada, we need to act proactively about genocides in other places. And I don't think, as when I think about, for example, when I was an emergency medicine fellow, I did a pediatric ICU rotation, and we spent large amounts of money and resources to save one child, right? And I think that that is completely appropriate. I think that every person's life is worth more money than all the money in the world. And I think that as physicians, if we lose track of our humanity, if we lose track of the fact that it's all about the patients, that becomes really problematic. And we need to be thinking about our patients here, but also the patients, because as physicians, we're quite fortunate to make a good salary, and we pay quite a lot of taxes to the Canadian government that are then being used to kill other people, right? So we are directly impacted in the genocide, whether or not we want to really admit that. And what you're saying about that reminds me, I had a friend in Gaza who texted me this week, and I said to him that his life was worth more than money or anything in the world. And he said to me, our lives mean nothing to them. He was talking about the international community. Even animals seem to have more value in their eyes than we do. I don't know what we've done to deserve seeing and living through all of this. While the entire world watches and no one moves to stop the death, hardship, humiliation and hunger we face every day. So let me just finish the quote here because I want to make sure that I read it correctly. So, yeah, he said, no one moves to stop the death, humiliation, and hunger we face every day. I'm truly lost. We've reached the point where we walk towards death with our own feet just to get a little flour to feed our families, and sometimes we don't even get it. Like what happened to me when I came back empty-handed. And on top of that, I lost my phone. What a shameful life we are forced to live. So I think that as physicians, we need to recenter the value of every human life, including our Palestinian colleagues, our patients, the Palestinian patients, the Palestinian people, and the Palestinian children. When we talk about things like the babies lacking formula and people going to the aid distribution points who are killed.
Has the Canadian government lost track of this value of protecting human life?
Definitely in this related to this particular issue, I believe that they're lacking some moral clarity at this point. I don't think that we would accept that our children would, or any adults or children in Canada would be burned alive. And that's something that happens regularly in Gaza,
Yeah,
in addition to many other injustices that they're experiencing.
yeah. And I wanted to talk a bit about the supply of arms to Israel. A couple years ago, I went on a tour of all the different war factories that we have here in Quebec, and I realized that every morning in Quebec there's thousands of people that get up and they go to work making bombs, artillery, rockets, fighter jet components, all sorts of military equipment that is ultimately being used to kill. In fact, there's a factory in Valleyfield, a weapons factory of General Dynamics that's looking to do a massive expansion. The same company has a facility in Repentigny where there's 1,350 people that work there, including 300 scientists. And they're literally building and testing bombs at this facility. You mentioned in another interview that one of the bullets that you removed from a patient may have been made in Quebec. Can you tell us a bit more about that?
Well, I remember that case very clearly because it was a young man. I don't know his exact age. Uh, who had come in. He came in walking. He'd been shot in the back, and he had a bullet lodged in his sternum. And the surgeon came down, and we pulled out the bullet together. And afterwards, and I have a video of the bullet being removed and a picture of the bullet. And afterwards, I thought about our Canadian role in the genocide. I don't have great bullet identification skills, so I wasn't able to identify which bullet it was, made by which company. But we know, for example, many of my colleagues went to the CanSec um, arms show that happened in Ottawa in May.
Yeah,
And
so I was reading about that. That's this annual show they have in Ottawa where basically the defense ministry shows up and they have all these different companies from different parts of the world selling all kinds of military equipment and kind of showcasing it with kiosks and that sort of thing.
that's right. And it says that and it said there, I was reading an article about it that said that General Dynamics is the only company that makes 155 millimeter caliber artillery shells, which have been used to attack Gaza. And one source said that by November 25th, just one Israeli brigade fired 10,000 such shells, sorry.
Right.
Right? So Canada, our Canadian companies, our Canadian economy, our banks, and our government are very, and our institutions are very involved in this genocide, right?
Yeah. That's it. So there is a possibility that those bullets were made there because I know General Dynamics has some facilities in the United States, but they certainly have a very large footprint here in Canada. And of course, with Mark Carney, who's now announced that they want to meet this new radically increased NATO spending target of 5% of GDP, which a lot of people would confuse for 5% of government spending, but actually 5% of GDP could be over 25 or 30% of all federal government spending, which could outpace federal spending on healthcare and retirement benefits and all kinds of things. So if that happens, if they live up to that 5% commitment, then we could expect to have many more war factories built in Quebec and across Canada, and really see an increasing complacency and active participation of Canada in global conflicts by supplying weapons, making Canada more of a weapons supplier. So I hope that the federal government turns around on that, and even 2% of GDP on military spending is a tremendous amount of money that could be used for so many other things. And I don't think that they'll increase taxes to reach the target. They're probably going to cut social programs and cut healthcare and that sort of thing. So we got some really difficult years ahead, I think, for the peace movement here in Canada and in many NATO countries and around the world to try and stop this continual escalation of buying more and more weapons. And then if the government has all these weapons, they're far more likely to use them so that their supply can be replenished and all these arms manufacturers can continue to get contracts. Um,
Yeah, absolutely. So Canadians for Justice for Canadians for Justice and Peace in the Middle East put out shared a few interesting facts about that recently. So they said that Canada had exported 18.9 million in military goods to Israel in 2024. So that means this was during the current genocide. And also they were saying in March that Canada broke their promise on arms to Israel by allowing 78.8 million contract for artillery propellants. So, just like you said, we've been highly involved in providing the munitions required to continue to create this genocide.
Yeah. And what do you think about the different companies that are profiting off of what's taking place?
Well, I think that as Canadians, we need to recenter our values, and we need to take concrete action towards and against these companies, right? And we
Yeah.
need our politicians. We voted for them, and we need to ask them to act very concretely, decisively, and to follow through on what they said, right?
Yeah.
They've been talking about having an arms embargo, but that hasn't actually taken place yet. We need to have a real arms embargo.
Yeah. And I know this whole situation is obviously very very negative, sad, horrible. You've seen a lot while you were over there. Is there any story that you can recount that gives you hope about the future, or a story of resiliency that you experienced while you were there?
I had so many beautiful um, and sacred moments while I was in Gaza, and I remember so many moments of extreme kindness and towards me. For example, I spent my birthday in Gaza, and I ended up going to someone's house, and she invited me over to drink coffee, and then she said, "Oh, I want to give you this lipstick," and then all the internal medicine residents decided they were going to cook for me, and we had dinner together, and they were so kind with me. There's also a medical student who said to me, "Are you cold? Can I bring you some extra pair of pants to wear at night?" And she was living in a shelter that didn't have four walls. So she was actually also very cold at night, but she offered me her limited clothes. People have limited clothes because of the repeated displacements. So I've had so many moments like that. And at the end of all that kindness that they showed me on my birthday, I said to them, "Oh, I had a great birthday with you." And they said, "Oh, we didn't even know it was your birthday." They were just
Hmm.
being hospitable and kind.
Yeah.
Yeah.
Yeah, I guess people are very, very appreciative, right? Because I don't think it's just anybody or just any doctor that would, go there to deal with this extreme situation while putting themselves at risk to take care of other people. So I think it's really commendable that you've gone out there. And I first met you at a protest in front of the Israeli consulate in Montreal at Westmount Square. And so I see that you're making speeches and protests. You're very active in bringing attention to this issue. Could you tell us a bit about your activism side and what your plans are for your work in social justice going forward?
Well, I, as I think about how I want to respond to what I saw in Gaza, I want to do the maximum. So every opportunity that I have to advocate for my patients, for my colleagues, I want to do that. So I'm thinking of some ideas of some articles that we could write about healthcare workers' experiences in Gaza. We plan on returning to Parliament to speak with politicians, keeping those connections open, keep continuing to share stories on social media, and continuing to support and stay in contact with my colleagues and express costly solidarity, however they may ask me to, or however maybe might be best.
Yeah. Is it frustrating speaking with the politicians in Ottawa where I imagine they listen, but then the actions do not, follow what you're asking for?
Well, I think that we need to take the approach of um, that I see by those I admire, right? Like I have a mentor, and he told me that Palestinians are not able to just become hopeless and give up. They don't really have the privilege of doing that. They have to lick their wounds and then get back to the fight, or get back to asking for justice. And As I think about returning to speak to politicians, there are some meetings that seem more helpful than others, some meetings where there seems to be more actions planned than others, but I'm never going to accept a world where people are treated the way that I saw people treated in Palestine, and where my friends and my family, in a metaphorical sense, and my patients and my colleagues are experiencing the conditions that they are having in Gaza right now. I hope that I wouldn't accept that for anyone. I wouldn't accept that for any acquaintance, for an enemy, for a friend, for a loved one. And I don't plan on accepting it anytime soon.
Yeah. I think that's really inspiring what you said about, not having the privilege to stop, not being, able to just say, well, I'm overwhelmed by this and I've done my part and that's it. This push to you need to continue. You don't have the privilege to be able to stop because of what's happening. I think is something that can inspire a lot of people to take action and to stand up for things, even when it can become uncomfortable. In family situations, with friends sometimes, with the media, even in some of these meetings, facing these sort of brick walls, of people who hold power but refuse to use it to stop a genocide. So I want to really thank you for everything that you've done for Palestine and everything that you've done to push Canada to take a more reasonable and humane approach to what's taking place, to end Canadian support for this genocide. And thank you for coming on the show and look forward to staying in touch.
Thank you. It's been an honor.